Hello, I'm Dr. Srikanta J T, consultant, Paediatric Interventional Pulmonology, General Pulmonology, and Sleep Medicine, Aster CMI Hospitals, Bangalore. Today I'm going to talk to you about something called as obstructive sleep apnea. What do you mean by obstructive sleep apnea? What are the causes of obstructive sleep apnea? How your child or anybody else's child has obstructive sleep apnea? What are the tools to diagnose obstructive sleep apnea? And at last, what is the treatment for it? So, what is obstructive sleep apnea? Obstructive sleep apnea is when a child sleeps, has significant amount of snoring, has open mouth breathing, has frequent tossing and turning, has gasping and choking. What do you mean by gasping and choking? Your child will snore. So this is a gasp and choke. That means your child is struggling during sleep. So is this considered as normal? Absolutely no. Apart from that, your child might just teeth grind. Your child might also have significant amount of daytime symptoms. Like wake up in the morning, very unrefreshed, has a little bit of swelling underneath the under eyelid, a little bit of duskiness, is becoming more hyperactive, attention deficit, behavioral issues, temper tantrums, becoming more and more scholastically poor in the school. These are all signs and symptoms of obstructive sleep apnea. So, second question is, why does it happen? Normally, adenoids and tonsils are structures in our body which increase in size as the age progresses until up to a certain age, and then they start stagnating and then regressing. But that happens over a period of time. So from 2 years to 6 years it increases, from 6 years to 9 years it kind of stagnates, and then 9 years it starts regressing. So if a child starts having adenoids and tonsils which are becoming more bigger from age of 2 years, child will have to sustain that growth until up to 6 years, because that is where you are exposed to so many infections, and infections will lead to these adenoids and tonsils getting bigger. So if your question to me is going to be what is adenoids and tonsils, these are lymphoid tissues in your body which are there to prevent and protect you from infections. They are like entry gate to your infections. But at the same time, what you also need to understand is, if your child continues to have problems because of an organ which is enlarged more than what it is supposed to be, that means it is a problem. So adenoids and tonsils are just one part of the spectrum. We have children with genetic syndromes coming to us with similar problems like Downs, hypothyroidism, Apert syndrome, Cruzen syndrome, a lot of other craniofacial abnormalities. We have children coming with obesity. They have become so obese in the COVID that their weight are almost more than what we considered obese, isn't it? 25, 26, 28, 30 BMI, body mass index is more than 30. So we have children coming with them. Again, in them, is adenoids the only issue? No. Obesity, lot of fat around the neck can also cause obstructive sleep apnea. So how do we diagnose them? How do we move forward? So usually adenoids and tonsils, after a brief clinical history and examination, we have multiple ways of diagnosing adenoids as well as tonsils as well as any other possibilities. So usually the easiest is to ask for X-ray of the adenoids, which is going to let you know grade 1, grade 2, grade 3, grade 4. But again, grades are always deceptive. A child might have grade 4 adenoids, that is very huge one, but not have any symptoms, whereas some children have grade 1 or grade 2 but have significant symptoms. So again, it's not always gold standard. We also do endoscopic examination of the adenoids. Apart from that, there are other modalities, but currently gold standard is a sleep study, wherein a child sleeps with all the things on head, face, legs, everything, to monitor how is the child sleeping, quality, quantity of sleep, arousals, and what is the oxygen happening, what is the carbon dioxide doing, and everything is given into your report. And if the report says it is severe, that means your child has a significant problem which needs to be taken care of. If it is mild to moderate, that needs to be taken care of accordingly. But again, reiterating, gold standard is always going to be a sleep study, a nighttime sleep study, until we get something which is going to be even better than that. And now coming to treatment, if it is severe and if your child is having significant symptoms, I am not going to just say wait and watch. I am going to tell you, please, surgery is the only solution. But if it is moderate to mild, I will still consider treating your child with medications. What are the medications that I can use? Two excellent medications. One is called as intranasal corticosteroid. The other one is montelukast. intranasal corticosteroids are the standard of therapy in children who have mild to moderate obstructive sleep apnea. And if and only if the child doesn't get better with this, then only we add on montelukast. So this is how we treat them. And most importantly, what people also need to understand is adenoids are always associated with allergic nose. When a child comes to you with adenoids, they also have they keep itching their eyes, keep itching their ears, and if they have allergic rhinitis, always treat their allergic rhinitis first before even doing something to adenoids. You treat their allergic rhinitis, 90% of the times adenoids will not cause any concerns. So always look for comorbidities, and if OSA coexists with allergic rhinitis also has to be taken care of, and not only adenoids. And most importantly, we have all the facilities, particularly a sleep lab in our center, to help your child breathe well. And if in case of any sleep study appointments, you can always contact us in Aster RV hospitals. Thank you.